Hello, you're welcome back to our channel where we talk about pregnancy and other women related health issues. Are you thinking that you are pregnant? These are some symptoms which you can discover if you are even 1 week pregnant. If you have these symptoms, you should think of pregnancy. Let's go. First that you can think of is nausea and vomiting. You can feel nauseous, you can feel as to vomit. This is because of the presence of the hormone called the human chorionic gonadotropin hormone, which is present in the blood. It can lead to nausea and vomiting, but of course, not everybody might feel the signs and symptoms. The second is breast tenderness. You can feel your breast a little bit tense, and if you even touch your breast, it might be tender, it might be painful, and you can feel it more engorged than other times, because normally in a woman, before you want to see your period, your menses, your breast might be tender, and after the bleeding period for your menses, the breast becomes soft. So this tenderness can persist, so you feel your breast a bit engorged and painful, but lightly, not really painful as such. So that's the second. The third is fatigue. You might feel so tired. You might feel weak and not really feeling as to do anything. Sometimes someone who is very active and you start feeling this kind of weakness, you might start thinking that, oh, it means I might be pregnant now, especially for people who have been trying for that month, and they have calculated their fertile period. They know that they want to take in this month. Once they really start feeling that signs, they might already know that, hey, maybe finally I'm pregnant. The next is mood swings. You can have mood swings, women. You have the mood swings to now you're laughing, the next moment you're not laughing again, or you want these. You just tend to confuse people around you. Once they start asking you that question, why are you moody like that? Why is your mood changing? You should start thinking that, oh, maybe I'm pregnant. The next one could be cravings. You start craving for a particular kind of thing, and the next minute you might be craving for something else, especially if they bring another thing. So that's you could see that, especially as early as possible, 1 week pregnancy. You could also have spotting. Spottings are like what we call implantation bleeding. Some people think that this is their menses. Some people are always saying they see their menses throughout their pregnancies, but is this mostly what we call implantation bleeding. And sometimes you can have just a tear at the level of just a split at the level of the placenta towards the end, which can bleed sometimes, and you feel that it is your menses. So once you have this implantation bleeding, most of the times the difference with your period is that it is dotted, it is spotting, it is not really coming out as bright as your menses, and it might not take that long. If you have been seeing your period for 3 to 4 days, you might see it just 1 or 2 days and it's just spotting. You might not change your pads frequently or tampons frequently like if it was your period. Now another point is a missed period. Of course, once you've missed your period, we're expecting that ovulation occurred and you got pregnant. Therefore, 2 weeks after, we should be expecting that you should miss your period. And if you miss your period during that time, of course, that would make you think that, or confirm your suspicion that you might be pregnant. But of course, you have to do the pregnancy test, and after doing the pregnancy test, an ultrasound scan to make sure that the baby is well positioned and the baby is well formed. Those are the procedures. So these are some signs and symptoms of early pregnancy. I hope this was helpful. Don't forget, subscribe. If you want to have a one-on-one consultation with me, don't forget to click on the link below. Join our community where we talk more about pregnancy. We can follow you up and you can have a chance to book a one-on-one consultation with me, and we can follow you up throughout your pregnancy. And there we also talk about all women related health issues. Thank you for watching. Bye, and subscribe. Share our video.